Hello, I'm Lauren.
Hi, my name is Haley, and today we're presenting on allergic reactions. So, what is an allergy? By definition, an allergy is a condition in which the immune system reacts abnormally to a foreign substance. And the foreign substance or triggers can include pollen, mold, animal dander, certain foods, or things that can irritate your skin. An allergy is actually pretty common. 1 in 5 Americans have an allergy.
An allergic reaction can be defined as exaggerated sensitivities or hypersensitive reactions that occur when your immune system responds abnormally to common substances such as pollen, dust, and certain foods. Allergic reactions are quite common and may happen seconds to hours after contact with the allergen. Some reactions may take more than 24 hours to appear. Though many allergic reactions are mild, others may be dangerous or life-threatening. They may be localized, involving a small part of the body, or may affect a large area or the whole body.
So, what actually happens during an allergic reaction? An allergic reaction begins when you touch, inhale, or swallow an allergen. In response to this trigger, the body starts making a type of protein called immunoglobulin E, or IgE. IgE molecules bind with allergen molecules in an antigen antibody reaction. This attachment of the antigen and antibody leads to the release of some chemicals, such as histamine, in the body. These chemicals cause inflammatory symptoms of allergic reactions, such as rashes, itching, and sneezing.
Your symptoms depend on how you're exposed through the air, your skin, food, or through an insect sting. If you have a nasal allergy, one that is triggered by something you inhale, common symptoms may include itchy, watery eyes, sneezing, itchy, runny nose, or feeling tired or ill. Common symptoms of a skin allergy include rashes and hives, which is a rash with raised red patches. And food allergies can also cause stomach cramps, vomiting, and diarrhea. If an insect sting was a trigger, you'll be swelling, redness, and pain where it stung you. Symptoms can range from mild to severe. Most go away shortly after the exposure stops. Mild ones may be almost unnoticeable. You might just feel a little off, while moderate symptoms can make you feel ill as you've got a cold or even the flu. Severe reactions, on the other hand, can be extreme.
So, how do you get relief? You can find treatment options for mild to moderate allergic reactions. Antihistamines and decongestants can help treat certain symptoms, as can nasal sprays. If you have an allergic type asthma, your doctor might also prescribe an inhaler to ease attacks, or they might inject a special antibody to manage your symptoms. If you don't get enough relief by avoiding your allergens and using medications, your doctor may want to give you an allergy shots. This type of treatment is called immunotherapy, and it can be effective for hay fever and allergic asthma. Another type of immunotherapy involves tablets that dissolve under your tongue. For sinuses, and over the counter medication might ease your symptoms.
So, who can get allergies? Anyone can get them at any age. You could develop them as a child, or you might not have any symptoms until you're an adult. Why are some people sensitive to certain allergens while most aren't? The major difference is in your genes. Allergies run in families, so if your parents have allergies, you probably will too. If one parent is allergic, your odds will go up, and if both are, your chances more than double. If neither parent is allergic, there is still a small chance you'll get them. Your parents can pass on the tendency to get allergies, but you may never actually have symptoms. Or you may wind up with allergies, but not the same ones as your folks. The world around you plays a part too. You have to have a tendency and be exposed to an allergen before you develop an allergy. The more intense the exposure is, the more often you come into contact with the allergen, and the earlier in life this happens, the more likely you'll be allergic. Other things that may lead to allergies include smoking, pollution, infection, and hormones.
So, is it anaphylaxis reaction? The most severe allergic reaction is called anaphylaxis. It affects your whole body. Anaphylaxis happens when you have an antibody, something that usually fights infection, that overreacts to something harmless like food. It might not happen the first time you come in contact with the trigger, but it can develop over time. Anaphylactic reactions usually start within minutes of contact with the trigger, but they can also happen an hour or more later.
So, what are the causes of anaphylaxis? In children, the most common cause is food. For adults, the main cause is medication. Typical food triggers for adults are peanuts, shellfish, fish, milk, eggs, soy, and wheat. Common food triggers for adults are shellfish, tree nuts, and peanuts. Common medication triggers are penicillin, muscle relaxants, like the ones used for anesthesia, aspirin, ibuprofen, and other nonsteroidal anti-inflammatory drugs, as well as anti-seizure medications. In some rare cases, these can also cause anaphylaxis. Pollen, stings from bees, wasps, yellow jackets, hornets, and fire ants. Latex, a combination of things, 2 to 4 hours of exercise after eating certain foods, and exercise on its own. Symptoms can also include highs and itching all over, wheeziness or shortness of breath, hoarseness or tightness in the throat, or tingling in the hands, feet, lips, or scalp.
So, how do I treat anaphylaxis? Anaphylaxis is life threatening, so you should call 911 right away. If you have an epinephrine autoinjector, use it and repeat after 5 to 15 minutes if your symptoms haven't improved. You will still need medical care right after you give yourself the shots, even if your symptoms seem to stop, because a delayed reaction could still happen to you.
So, what is an EpiPen? Also known as an epinephrine autoinjector. It is a way to deliver medication quickly and effectively to someone who is experiencing anaphylaxis, a severe and potentially life threatening consequence of an allergic reaction. You may also see autoinjectors referred to as adrenaline autoinjectors. Because anaphylaxis can be life threatening, it's very important that someone experiencing symptoms receives treatment as quickly as possible. The epinephrine present in an autoinjector works to reverse the symptoms of what could be a severe acute allergic reaction.
So, here are some EpiPen myths and facts. Some people believe that you should wait until symptoms are serious to use, or you must remove clothes to use it, or you must use an EpiPen will solve the problem. But these are just myths. The facts are you should use an EpiPen as early as possible, even if you're unsure. An epinephrine injector will work even if it's inserted through thick clothing. And also, once you use it, you still need to seek medical attention.
So, how do you administer an EpiPen? The first step is to carefully remove the autoinjector from its clear carrier tube. Next, grip the barrier of the autoinjector in your dominant hand so the orange tip points downward. Make sure your fingers aren't close to either end of the autoinjector. Then use your other hand to pull straight up on and remove the blue safety release. Do not twist or bend it. Then firmly inject the orange tip of the autoinjector into the middle part of your upper thigh, pushing until it makes a clicking noise. This lets you know that the epinephrine injection is underway. Next, hold the autoinjector in place for at least 3 seconds, counting off slowly before removing it from your thigh. Use your fingers to gently massage the area of the injection for about 10 seconds after. And finally, call 911 to seek emergency care or tell someone close to you to call.
So, how do you administer an EpiPen to a child? First, you should repeat steps 1 to 3, as mentioned before. Then, you should position the child to receive the injection. Older children can sit or lie down, and smaller children may need to be held in your lap. Be sure to hold their legs gently yet firmly in place. Then, you should repeat steps 4 to 6. Note that you should not use an epinephrine autoinjector on a child if the blue safety release is raised or if the autoinjector doesn't slide out of its carrying case easily. Contact their healthcare provider and the manufacturer instead.
Some other notes to consider when using an EpiPen. First, an epinephrine autoinjector can be administered through clothes if necessary. Sometimes the person may need a second dose, which requires an additional autoinjector should they not respond effectively to the first dose. If you need to administer an epinephrine autoinjector to another adult, Follow the steps above and administer the injection into the upper thigh. It may help to administer the autoinjector while the person is lying down or sitting.
So here is a video on how to use an EpiPen on someone else.
How to use EpiPen on someone else. If your child or someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why EpiPen should be used at the first sign or symptom of a severe allergic reaction. Just follow these two simple steps. Grasp the Epipen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of their outer thigh. Swing and push the orange tip firmly into their mid-outer thigh until you hear a click, and hold on their thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend to cover the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. The extended orange needle cover and black indicator in this window will show you that EpiPen has delivered its epinephrine. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. Anyone receiving an EpiPen injection must seek medical attention immediately. The effects of epinephrine can wear off, or a second reaction could occur. Call 911 or take the individual to an emergency room right after using EpiPen. If symptoms continue or get worse, you can use another EpiPen or EpiPen Junior 5 to 15 minutes after the first dose. Do not inject more than 2 injections right after each other. Remember to bring all the used EpiPen autoinjectors with you to the hospital. Give them to a healthcare professional for inspection and disposal. After getting medical help, stay close to a hospital or where you can easily call 911 for the next 48 hours. If you are the primary caregiver for the individual at risk, remember to ask for a new prescription for multiple EpiPen autoinjectors. How to use EpiPen.
So, something else that may be commonly associated with allergies are antihistamine medications. Antihistamine medications, such as Benadryl or Claritin, can be used to either prevent or ease allergy symptoms. It's appropriate to use these medications to relieve mild allergy symptoms such as sneezing, itchy or watery eyes, and hives. Not only do they not only do they act as quickly not as quickly as epinephrine, but they also can effectively prevent or reduce some of the more serious effects of anaphylaxis, such as area obstruction and low blood pressure. If you or someone else is experiencing anaphylaxis, epinephrine should be administered immediately. You should then get emergency medical attention.
So, what to do in an emergency when someone is experiencing anaphylaxis reactions? First, you should call 911 immediately. You should ask the person if they're carrying an epinephrine autoinjector on them. If so, ask them if they need your help in administering the injection. If they do need your help, help them administer the epinephrine autoinjector. Then you should loosen any tight fitting clothing on them. Help the person lie on their back. If they're feeling nauseous or have vomited, gently turn them on their side. Also, turn them on their side if they're unconscious, pregnant, or having trouble breathing. Then you should remove any allergy triggers if possible. You should also cover the person with a blanket if there's one available nearby. Avoid giving them any food or drink. If a second epinephrine autoinjector is available, give another injection if symptoms haven't improved in 5 to 15 minutes. However, more than 2 injections shouldn't be given without the supervision of a medical professional. If there are no signs of breathing, you should administer CPR. You should also stay with the person and continue to reassure them until help arrives.
Some other safety tips to keep in mind is to identify and avoid your allergy triggers early on. Examples of common allergy triggers include medication, insect bites or stings, foods such as peanuts and shellfish. Always carry your epinephrine autoinjector with you. Try to carry the double pack just in case you have a reaction and one dose doesn't alleviate your symptoms or your symptoms come back before help arrives. Check your autoinjector regularly. Note the expiration date as well as the color of the liquid in the injector, which should be clear. Replace your autoinjector if it's close to its expiration date or the liquid is discolored. Always store your epinephrine autoinjector at room temperature. Extremes in temperature may cause the medication to be less effective. Knowing signs of an anaphylactic reaction is important. Knowing this information can allow you to promptly administer your autoinjector. Know how to administer an epinephrine autoinjector. Be sure your family, friends, and caregivers know as well. Many manufacturers include a practice injector so you can practice administering an injection. Let others know about your allergy as well. This helps them know what to do in case you have a reaction. Consider wearing a medical ID that lets people know about your allergy. And lastly, always seek emergency medical treatment if you are experiencing anaphylaxis. Do not just wait for your symptoms to improve.
So, can the COVID vaccination cause allergic reactions? Experts say the number one suspect for these reactions is an ingredient commonly found in cosmetics, other medicine, and laxatives called PEG. The CDC says the reactions are still rare and investigations are ongoing. The ingredient in question is used to stabilize current COVID 19 vaccines, but PEG has caused anaphylaxis, severe allergic reactions in the past, as noted by a Banner Health physician. PG is in both Pfizer's and Moderna's COVID 19 vaccines, which are currently the only ones with emergency use authorization from the FDA. The rate of severe allergic reaction to the vaccine is so far is a little higher than that of past vaccines, though that number might change in the coming weeks. The rate, at about 11 cases for every 1 million patients, is still well below 1% and means that the vaccine is considered safe. So, is it safe for you to get the COVID vaccine if you have known allergies? There have been a few, in fact, very few instances of severe allergic reaction to the current vaccines. These have occurred in people who have had a history of severe allergic reactions and already carry EpiPens. If you have ever had a severe allergic reaction to any ingredients in a COVID 19 vaccine, the CDC recommends that you should not get that specific vaccine. You can check out the vaccine's ingredients online. If you have ever had a severe allergic reaction to other vaccines or other injectable therapies, you should ask your doctor if you should get the COVID 19 vaccine. Your doctor will help you decide if it's safe for you to get vaccinated. If you have a history of severe allergic reactions not related to vaccines or injectable medications, such as allergies to food, pets, venom, or latex, you can still get vaccinated. People with a history of allergies to our medications, a family of severe allergic reactions, or who might have a mild allergy to vaccines with no anaphylaxis reaction, you may also still get vaccinated. If for some reason you had a severe allergic reaction after getting the first shot, then you should not get the second shot.
We hope you are able to learn important information about allergies as well as how to address allergic reactions in the future. If you have any questions, you can email us at buildingtodaysheroes@gmail.com. Thank you.